Hello friends, welcome back to my channel. If you guys are new here, my name is Shreyas Vinayak and I'm a junior doctor currently working in NHS England. So today I have here with me Rohan, a colleague of mine.
Hi guys, my name's Rohan Varghese. I'm from India and I'm currently a GP trainee in the University Hospital of Nocturne. I'm working in stroke unit as of now with Shreyas here.
Yeah, so in today's video what we're going to cover is essentially Rohan's experience working in India, the reasons why he moved to the UK, as well as at the end we'll touch a bit about his experience sitting for the PLAB exam, which is the entrance exam to the UK. I hope you guys enjoy the video. Please hit the likes and subscribe button and let's get started. So Rohan, can you just tell us where did you study in India?
So I did my undergrad in Bangalore and then after that I worked for a bit before coming here to pursue my GP training.
Right, okay. And how long did you work for?
So I worked for about 8 months in 2 different hospitals after my F1 year in my undergrad itself.
Right.
And then after that, I came here and I worked for about a year plus in A&E in a place called Lincolnshire. And then after which I joined GP training just starting last month.
Right, okay. All right. And just to go back to your move to the UK, so you worked in India for about 8 months. Can you just talk us through how that experience was?
So if I'm to compare the system of work in India and here, there has been quite a considerable and significant difference. Work here is a little bit more practical oriented, a bit more diversified. It helped me understand my basics that I did study in undergrad a bit more, because the practical application of our basics back home weren't being put into complete and good use while we were in our initial few work years right after undergrad. Since coming here, I've been able to handle situations a bit better, acute situations, where I know if I were to continue for a bit back there, I may not necessarily have been able to. I'm not demeaning the system back home completely, but I just find that it's way too theoretical to continue on a clinical basis.
Right, okay, that's quite interesting, because my parents actually studied in India and they always talk about how the clinical experience you learn in India is far significant to any other country because of the number of patients that they normally see in a day, as opposed to what we do in the UK or even Malaysia for that matter. So it's quite surprising that you say that.
Well, I think it could also be a matter of where I worked.
Right, okay.
So you will have there is quite the disparity where a few colleges would be much better in terms of their teaching. So it could be that.
Right.
But apart from that, even since I did work in a few hospitals after I did my F1 year, I just feel that it wasn't way too involved in patient care as what I have seen when I've come here.
Right.
So it's more of the change that I've noticed.
Yes.
I'm not saying that India doesn't have good medical care. I'm sure they do, and that's why I did my undergrad there. But it's just the again, like I said, the significant difference between it's overall generally been better since I've come here.
All right, okay. Just to touch upon the job of an FY, the workload. For instance, comparing these two countries, how would you say it fares?
That honestly, I would say is more taxing back home in India, because I have probably been a little bit more lazy when it comes to working here. I found that we had longer shifts there. So the experience we got there through the F1 was probably not a bad experience. It did help us develop certain skills. At least it developed a bit of a work regime as well. Since it was that busy. So I think that was a good platform to come here as well. It was more of my clinical experience after the F1 year which kind of diminished and brought about a comparison where I felt the UK is better.
Right, okay. So you would say essentially the training for an F1 is quite good back in India, as opposed to your further training in terms of your specialty or...
Well, overall I would say that yes, it while it did give a platform, there were a few nitpicks where
Right.
I would say that half of the F1 year is more clerical work
Right.
than anything else.
Yeah.
So I'm not entirely sure how the F1 year sits
It's
here.
not that much different, but
So so I would say that if it is pretty much the same, I
Yeah.
guess it's the same all
yeah, I
around
guess.
the world.
Yeah, exactly. Okay, and in terms of the support that you get from seniors and superiors, comparing both the countries, do you feel you're a lot more supported in the UK? Because that's something that the NHS and the healthcare system is quite proud of.
And that would be preferably here. I found that much better when I did come down here. I was a little hesitant because back home it was more of a hierarchical society where to approach a consultant is quite a scary thought.
Right.
You really would rather go through the postgrads, the registrars, before you attempt to go to the consultants. There was that inherent fear.
Yeah.
But here it's like there is no significant barrier present.
Yeah, true.
I just feel that they are much more approachable.
Yeah.
They treat us as their own colleagues in
Yeah.
terms of there is no inferiority complex
Yeah.
present. They treat us as if we are on the same level as
Yeah.
well. They teach us actively.
Yeah.
So I find that to be one of the foremost factors in what I find as much better here.
Yeah, even having friends working in Malaysia at the moment, I hear these horror stories of how consultants cannot be disturbed, or even if you have any serious conditions or any serious patients, you should always go through the registrars, which is normally what we are taught here as well. But if you have a consultant on the ward, you have no issues with actually just asking for advice. They are more than happy to help. You mentioned that you were planning to sit for the USMLE, which is the entrance exam to the US. Comparing that to PLAB, you felt that PLAB was a little bit easier to manage.
Absolutely. So quite the difference in the level of difficulty.
Yeah.
I think with the MLEs, you're going to be sitting for a longer period of time.
Yeah.
It would be preferable if you start from your undergrad level itself.
Yeah.
Maybe from your third year.
Yeah.
If you were to really sit the exams, because it requires quite the large medical-based knowledge.
Yeah.
And it is different from our studies to an extent from back home.
Yeah.
So we really have to sit on that simultaneously.
Yeah.
With the PLAB, while the material for the PLAB itself is slightly different from our textbooks back home,
Right.
I just find that our base knowledge does help.
Right.
And the material overall for the exam required is slightly less than required for the MLEs.
Okay.
And then we have a multitude of steps for the MLEs as
Yeah,
well.
yeah.
Step 1, step 2 having 2 parts, overall costs that are involved in it. So that really pushed me a bit further into the UK,
Right.
being only 2 steps. And when I did give the exam, it was a little easier than it is right now.
Okay. And when was it that you sat for the exam?
So I sat for the exam in late 2017 and
I see.
early 2018.
Right.
What I've gathered from my friends who have given the exams as of recent
Yeah.
is that they've increased the question bank pool that is usually being put forward for the exam
Right.
itself. It's a little bit more harder.
Yeah.
Now, in terms of preparation itself for the exam,
Yeah.
what I did was I came to the UK for it.
Right.
Because I finished my F1 year and I was looking at time constraints, so I'd rather come here, do a crash course,
Yeah.
and
finish
then get
off.
it done with.
Yeah. Definitely.
As of right now, though, doing a crash course like that may be a little bit too concise.
Right.
It may not be enough
No.
to clear the exams.
Yeah.
I think a preparation time of about 3 to 4 months at the least would be required to give the exam with leaving a good taste in the mouth at the end of the exam.
Yeah, especially now with COVID, the option of actually coming to the UK and sitting for the exam is obviously out of the picture. In terms of preparing in your home country, whether or not it's India, it's Malaysia, Australia, do you have any suggestions or any tips that you think that might be useful?
So in terms of home preparation, now there are quite a few online courses. You have PLABable, you have Past Medicine, Past Test. You have a lot of question banks online. You have online courses with the centers that are in the UK itself.
Right.
So even if with the COVID situation, if you're unable to do a face-to-face here, you can access these courses online.
Right.
So they are still accessible. And it would be suggestible to at least try with the question banks,
Right.
rather than going for the more expensive online face-to-face courses. But yeah, that is the first modality that you would consider for preparing for your first step.
Right.
When it comes to the second step, I'm not sure whether they have a lot of courses back home.
Right.
Because it is a clinic, it is the practical
Yeah.
station, so it would require a bit of hands-on experience.
Right.
You have a few courses here in the UK. You have Swami's in Manchester, Samson's in London, with the Hamid's course also in London. You have another few as well.
Right.
But these are the more popular courses that are usually taken up. And I personally did the Swami's course in Manchester, and I found it quite useful.
Right.
So I have no inclination towards any of these courses. I've heard that they are pretty good in their own respects.
Yeah.
But it would be suggestible to do one of these courses,
Right.
because it's not the theory that's given out during these courses that are required. It's even the hands-on experience that you would gain through it.
Prior to moving to the UK, did you already know that you would want to come into the GP training in the
It was one of my considerations, in all honesty. I was considering between the MRCP, the IMT route, and the GP route.
Right.
But having gone through the A&E experience, having done a bit of research as well, and with personal choices in the way for the future, I just thought that GP was a bit more suitable for me. So if I were to elaborate more on that, it would be like, I have considerations of doing Doctors Without Borders after a bit.
Right.
Now, if I were to go through the MRCP route, and I were to pursue that, I would become a consultant in about 7 to 8 years. With the GP, on the other hand, I would become a consultant in about 3 years.
Yeah.
I would rather have a degree and become a consultant before doing the Doctors Without Borders.
Yes, definitely.
And that is one way to fast track becoming a consultant. The other thing is both are medicine related, and one's hospital based, the other one's clinic based.
Yeah.
I prefer overall being more clinic based than in a hospital. With my A&E experience though, I did have a fondness for A&E.
Yeah.
So I would like to do that on a locum part-time basis.
Right.
And GP allows me that, where I could do GP for a couple of days and A&E for a couple of days. If I were to go the whole shebang route
Through A&E.
through IMT and become a medical consultant in the hospital, it feels like a waste of time to have become a consultant and then jump into A&E. So I just find that this route gives me a bit more balance. It gives me a bit more of doing a little bit more of what I would like, rather than sitting through the whole IMT route.
So if you had to do it all over again, would you still choose the UK, or would any other country be more appealing to you?
Now, having been here now for close to 1.5 years, I know in the overall scheme of things it may seem a little short, but I think I'm quite happy where I am right now. GP training has gone on quite fine, as of right now, and I think in these last 1.5 years, it has taught me a lot in terms of in the hospital and outside the hospital as well. So I don't know what the future really holds for me in terms of whether I want to go back home.
Right.
But for the foreseeable future of the next 10 years, I just think that I would want to stick with the UK, and I wouldn't have considered any other place really.
All right. Okay. Just to finish it off, any advice or any tips you would like to give anyone who's interested in moving to the UK from India or from any other country?
Well, I would suggest that they really decide, at least in the mid parts of their undergrad, where they really want to come in.
Right.
Whether they want to go into the UK, the US, or any other country. If they are considering the UK, you can always consider for the latter half of their undergrad, where they give their IELTS exam and then they go in for the PLAB exams. Again, they have only a time of up to 2023 or 2024 before the new exam comes into place.
Right. Okay.
But up till then, they can consider these exams. It is slightly easier than the MLEs, and UK is a pretty good place to form a career in the medical route and future as well.
Thank you so much, Rohan. If you guys have any questions at all, just drop a comment down below, or you can DM me on Twitter or Instagram. I hope you guys enjoyed this video. If you did, hit the like and subscribe button. I hope you guys are wearing your mask and staying safe out there, and I'll catch you all in my next video.